This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. Now, if you were like me, you played sports when you were younger, and of course you've got ankle problems today. Well, we're going to try to find out what's going on with those ankles as we sit down with Dr. Kristen Sandoe. She's an orthopedic surgeon who is fellowship trained in foot and ankle surgery. And today she tells us a little bit about what we can do about those bad ankles. Well, thank you for taking some time with us today. We're talking about ankles and ankle arthritis. Who would typically be affected by ankle arthritis?
So just from the beginnings, ankle arthritis is typically the inflammation of the joint that then really leads to destruction of the joint and the arthritic changes that happen. And typically about 70% of the people who do develop ankle arthritis, it's post-traumatic, meaning you've had a history of a bad ankle break, you've had surgery on your ankle in the past, multiple sprains. Then second up would be the inflammatory arthritis like rheumatoid arthritis, gout, things like that. It's very rare that you actually develop just wear and tear arthritis from the ankle, with the hip and knee being 9 to 10 more times common than the ankle arthritis. So post-traumatic is typically the people who we're going to see with that.
And being a former athlete, I think I know some of the symptoms involved in ankle arthritis, but what are some of the things other than just the pain in the ankle?
Some of those initial symptoms are going to be stiffness, particularly morning stiffness. Those first few steps are really uncomfortable. You get moving, it feels a little bit better. Some people get pain from the impingement because you develop bone spurs when you develop ankle arthritis, so you can get those sharp shooting pains, swelling, some redness, warmth around the ankle are very common presenting symptoms with ankle arthritis.
Are there simple treatments or things we can do to alleviate that impingement, that pain initially?
Early on, we try all the easy conservative stuff before we even consider surgery. It's basically activity modification and shoe wear modification. So if you're an impact athlete or you're someone who likes to do plyometrics or a lot of jumping activities, going to more low impact, stationary biking, swimming, things like that can really take the forces off that ankle and help a lot. Then there's simple things, shoe wear modifications, wearing higher top boots or a little bit more stabilizing boot, over-the-counter lace-up ankle braces, sleeve-type braces, and then anti-inflammatory medications. Again, it's an inflammatory situation, so you try and quiet that ice, taking it easy when you have a particularly bad day. And then next steps would be potentially cortisone injections. Cortisone injections, you don't know if it's going to help until you try, and you don't know how long it's going to last, and you can't have them forever, but it can help kind of mitigate some of that real sharp pain and some of that achy discomfort that you get.
And most of those options you're just talking about there seem pretty conservative, non-surgical.
Absolutely.
If we need to move into the surgical arena, what are we looking at?
Well, it depends on your stage of ankle arthritis and the deformity associated with it. And the foot and ankle, again, it's very complex. 28 bones, 30 joints. So it's a very complex part of our body. And you have to look at the foot as it relates to the ankle, because if you have a foot deformity, that oftentimes has to be addressed as well. Depending at the stage, if you're really early on, there's some controversy over ankle scoping or scoping the ankle, where you just clean out the bone spurs, clean out any loose cartilage. The results of that can vary because, in theory, the bone spurs are there to stop the ankle from moving because it's a painful joint. So if you remove that spur, you get a little bit more motion. That ankle arthritis can actually become symptomatic and be a little bit worse than what it was before. Next steps in the definitive treatments are ankle fusion, which is our gold standard. And what we're talking about is this joint here, so our up and down joint. Ankle fusion, basically you lock that joint in place and that no longer moves. It's what we had prior to ankle replacement surgery. Ankle replacement surgery, there's many companies now that have ankle replacements on the market that are showing good results, but basically that's where we resurface both the end of the ankle and then the top here called the talus, and you put a little piece of plastic in between and it recreates the ankle joint. Pretty technically challenging procedure, but really gives good pain relief. Results of the ankle replacement have been shown to last 15 years or so. A lot of revisions with that and a lot of risks with both approaches, but those are your surgical options when you're talking kind of what's my end stage outlook.
Sure, and does the replacement give you a little more mobility, a little more quality of life compared to the fusion?
It does. So the motion you have before surgery usually predicts how much motion you get after surgery. Obviously with the fusion, you lock that joint up, so there's no motion. The joints in the front of the ankle here make up for the lack of ankle motion, but it's still not the same mechanics. But there are a lot of studies that show very similar gait patterns with a total ankle replacement versus an ankle fusion.
Okay, so what is the timeline or what are we talking about from going from that conservative, maybe a cortisone shot to an ankle replacement? Yeah.
The longer you can delay, the better. Okay, and again, it depends on where you are in your life and what your activity level are. We know that ankle replacements tend to do better in those who are sedentary or less active. You know, you're not a laborer, you're not a big person, simple weight loss and things like that. So really you want to exhaust the simple stuff and deal with it as long as you possibly can. Obviously with the understanding of not limiting your quality of life as well.
Sure.
So when it really impacts quality of life.
Right. In terms of recovery and the outcome of surgery, you mentioned the replacement could be up to 15 years.
Up to, you know, ankle fusion. The joints around the ankle fusion can wear out in time, so you may need additional procedures with both ankle replacement and ankle fusion, but they both do very well and give good pain relief reliably. Okay,
so let's review really quickly here. If you're having severe ankle injuries, go see a trainer first, or how do we begin our steps to possibly surgery?
So usually you can certainly talk to your primary care physician, who then can either direct you to a sports medicine physician or an orthopedic surgeon. We're happy to see you and treat you through that conservative measures leading up to surgery if and when it's necessary. Just because you're seeing a surgeon doesn't mean you're going under the knife.
All right. Well, we appreciate you taking some time, and hopefully everyone's ankles are just fine, but if not, we know where to go.
Perfect. Sounds great.
Now, if you feel like you've exhausted all your options when it comes to making those ankles feel better, you can always give Dr. Sandoe a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.